Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the axilla. We'll go through the axilla. We have a lot of questions and certainly we have answers to the anatomy of the axilla. First of all, what is axilla? Axilla is also called armpit. The axilla junction between the thoracic wall and the arm. Okay. What structure forms the medial wall of the axilla? Okay, medial wall of the axilla is formed by the upper thoracic wall, particularly upper four intercostal space and four ribs, and the serratus anterior muscle. What structure forms the lateral wall of the axilla? Lateral wall of the axilla is formed by the intertubercular sulcus of the humerus. What muscles form the posterior What muscle form the posterior wall of the axilla? Again, the posterior wall of the axilla, we should have the subscapularis muscle, teres major muscle, the latissimus dorsi muscle, and the long head of the triceps brachii muscle. What structure forms the anterior wall of the axilla? Anterior wall of the axilla is formed by the pectoralis major muscle and pectoralis minor subclavius. Pectoralis minor and subclavius are connected by means of the clavipectoral fascia. They are enclosed by the clavipectoral fascia, and clavipectoral fascia is pierced by the cephalic vein, acromiothoracic artery, lateral pectoral nerve, and the lymphatics. Okay. Then, how the base of the axilla is formed? Base of the axilla is formed by the skin superficial fascia, and above that we'll get the axillary fascia. Okay. What structure forms the apex of the axilla? Apex of the axilla is not pointed. It is the inlet of the axilla. It is bounded by the clavicle, outer border of the rib, and superior margin of the scapula. And this is the apex, and apex will transmit the lower part of the brachial plexus, and this is the route through which the axillary artery, axillary vein goes up and down. Okay, here is our medial wall formed by the serratus anterior muscle and intercostal spaces. Anterior wall formed by the pectoralis major, pectoralis minor, and certainly subclavius. Underneath the clavicle we'll get the subclavius. We'll get here subclavius. On the posterior aspect we are getting that. Okay, and this is the posterior and lateral wall. Posterior wall is formed by the subscapularis, the teres major, the latissimus dorsi, and the long head of the triceps brachii muscle. Okay, here is the posterior aspect of the anterior wall. This is the pectoralis major, pectoralis minor, and the subclavius muscle. These two muscles are enclosed by the clavipectoral fascia. Okay, we discussed structure piercing the clavipectoral fascia. Okay, now we'll go to here. Okay, so this is the lateral wall that is formed by the bicipital groove of the humerus. This is the lateral wall of the axilla. This is the axillary inlet, again bounded by the outer border of the rib, superior border of the scapula, and the posterior aspect of the clavicle. Okay, so content of the axilla, again this is axilla, so we should get axillary artery and its branches, axillary vein and its tributaries, parts of brachial plexus, axillary lymph nodes. Actually we have groups of multiple lymph nodes, long thoracic nerve that is innervating the serratus anterior on the medial wall, intercostal brachial nerve that is present in the floor of the axilla, that is the lateral cutaneous branch of T2 that is associated with cardiac ref heart pain. We have a lot of axillary fat and areolar tissue on your dissection. And we got axillary artery, axillary vein, brachial plexus. Do you have axillary nerve? Yes. Axillary nerve is a part of the brachial plexus from the posterior cord. Axillary nerve innervates two muscles. One is the deltoid and the other one is the teres minor. Okay. So axillary artery and its branches are very important. Axillary artery is divided into three parts by the pectoralis minor muscle. This is the pectoralis minor muscle. Okay, this is the first part. Underneath the pectoralis minor is the second part. From the pectoralis minor to the teres major, we have the third part. From the first part, our branch is the superior thoracic artery. From the second part, we have the thoracoacromial artery and the lateral thoracic artery. From the third part, we have the branch subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. These two arteries encircle the humerus around the surgical neck of the humerus. Okay, so one branch from first part, two branch from the second part, three branch from the third part of the axillary artery. Okay, what is cervicoaxillary canal? That is the inlet or apex of the axilla that transmits the infraclavicular part of the brachial plexus and axillary artery, axillary vein, lymphatics. What is the extension of the axillary artery? From the outer border of the first rib to the lower border of the teres major. How the axillary artery is divided into three parts by the pectoralis minor muscle. How the axillary vein is formed and where does it open? Axillary vein is formed in the arm at the level of the lower border of the teres major muscle, maybe little up, little down, formed by the continuation of the basilic vein and union of two vena committantes of the brachial artery. Okay, so two vena committantes and the continuation of the basilic vein. And the axillary vein is from there. Axillary vein is outside the axillary sheath. It is not covered by the axillary sheath. And axillary vein opens into the subclavian vein just inside the first rib. Okay, so axillary vein end up in the subclavian vein and at the border of the first rib. Axillary vein, before opening into the subclavian vein, it receives the cephalic vein. Axillary vein also get a lot of tributaries. Those correspond to the branches of the axillary artery. It also gets some vein from the epigastric region and the lower abdomen. So what are the branches of the axillary artery? Superior thoracic artery from the first part, thoracoacromial artery, lateral thoracic artery from the second part. These three are from the third part, the subscapular artery, anterior circumflex humeral artery, and the posterior circumflex humeral artery. Axillary vein is how it is formed. Formed as a continuation of the basilic vein, lower border of the teres major muscle. Okay, and also contributed by the brachial vein. These are actually the vena committantes, vein accompanying the brachial artery. So contribution by basilic vein and to vena committantes, and it is passing underneath the pectoralis minor. It is outside the axillary sheath and it is continuing as the subclavian vein. Subclavian vein at the outer border of the first rib. Before it entering subclavian vein, it also receives the cephalic vein. It also receives some vein from the epigastric region and the vein corresponding to that of the axillary artery. Okay, where is the site of formation of the axilla? Lower border of the teres major, maybe little up, maybe little down. Where does the axillary vein end? End in the subclavian vein. Okay, Where does the cephalic vein end? Cephalic vein end is the cephalic vein and in the axillary vein. Okay. Is there any axillary sheath around the axillary vein? No. What are the thoracoepigastric vein? This vein drain the lower abdominal wall and also the epigastric region. Okay. And lower thoracic region, and they open into the axillary vein as a bypass route sometimes. Axillary lymph node is very important to us. Axillary lymph node is enlarged in case of breast cancer, okay, or maybe some type of infection here that also lead to trauma, lead to axillary lymph node enlargement. What are the location of central lymphatic lymph node? Here is the central lymph node here. We got here, this is the central lymph node. Where does the axillary lymph node drain? The axillary lymph node. Where does the humeral lymph node drain? The humeral lymph node is continued as the brachial group of lymph node, and they open into the central lymph node. These are actually not one node, these are groups of lymph nodes. Okay. Then what areas of lymphatic drainage for the subscapular node? Okay. Subscapular from the posterior axillary wall and the related structure. Again, it go to the central group of lymph node, apical group of lymph node, supraclavicular lymph node. Then it will go to the venous angle, the left venous angle, right venous angle. That's all about the anatomy of the axilla. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. And have a nice day. Bye now.